We started working together when you came to some evening classes that I offered on mindfulness for clinicians.
That's right. Yeah.
And Pat's come to Center of Gravity. She's on the board of Center of Gravity. She's been a friend, and also she took the 10-month mindfulness for clinicians course, I think the first year that I offered it, and also has been in the mentorship program with small parts of myself, but mostly with Norman Feldman and Molly Swan. So maybe to start, Pat, you could talk about what you do and how you ended up doing what you do.
Sure. So I'm a physician. I have been a physician. I graduated from medical school in 1982, and it was my second career. I was a social worker before I went into medicine. And I went into medicine because I was really committed to women's health in a sort of big picture way, specifically in reproductive rights. I did a residency in family medicine, and I practiced as a family doctor for about, 5 years. And at that time, I had lots of friends who were politically active in the reproductive rights movement, and they put a lot of pressure on me to, I guess in a way, put my money where my mouth was, to really become active as a physician in reproductive rights. And so I became an abortion provider at that time. And I worked 1.5 day a week and did abortions at a clinic in Toronto and did family medicine. And gradually I increased the amount of abortion work that I did, and eventually gave up my practice as a family doctor. So I've been doing abortions only for almost 22 years. I work at several sites, large academic hospital, small community hospital, community clinic, and I do really primarily that. I do some other reproductive family planning kind of work, I do political work, but mostly as a clinician, I'm an abortion provider.
When I hear about your biography, in terms of its history, the way you talk about the early years sounds political. So one of the themes when we talk about ethics, which is the subject of this course, is the relationship between how we are in the world, our belief system, how we act, how we think, our values. Could you talk a little bit about entering the world that you're in first through the political door, and how that may have changed over time?
Sure. Lots of people, I think, have their work and their politics separate. They do political work, they do the kind of social justice work separate from their work. And I really feel that it's been a privilege for me to be able to do both in one. It's both political and it's the way I make my living. But it did begin solely as really a commitment to a political idea, the notion that women had a right and a capacity to make decisions about their own reproductive health. And it simply was a political commitment. It wasn't particularly that I thought it would be an interesting clinical area to work in. It actually turned out over a period of years that was, luckily, it was also clinically interesting and challenging, but it really started out for me as an opportunity to really provide women with a service that I thought was really politically important. Had been, as a social worker, it had been important to me. But, when I first started, I trained with Dr. Morgentaler, and it was at the time that he was arrested here in Toronto. And a group of us, who at the time really had no intention of actually providing, agreed that we would train and do a press conference and say, you can arrest Dr. Morgentaler, but I will be there And then the next person said, you can arrest Pat and I will be there. And so it was really a way to support the sort of pioneering work that Dr. Morgenthaler did, that I really got started. So I did training then, and but really I didn't intend to do it. But, well, I did. In the long run, the call, the pressure from my friends and colleagues was enough that I really realized that it wasn't just going to be enough anymore to talk about my ideals, but I had a skill, I had a capacity to put that into action, and so that's how I did that.
Was there a difference from having a kind of political ideology, this is right, this is what should be done, this is what women need to have, and actually being there in the room with that particular woman? How have you negotiated that? Because sometimes, like I said earlier, there's a sense of, these are my politics, this is what I believe in. And sometimes as an activist, as a politician, as anybody with a belief system, we can have this idea, this is what women should have, and kind of not even see the woman who's right there in front of you. I'm wondering how that's come into your
that's probably affected me in a couple of ways. One is, maybe I'll speak about the second one first, and that is coming face to face with the reality of the lives that women lead. Hearing their stories, over and over again. All of them unique, even though there may be similarities, all of them unique, made the reason for doing this more humane, more human, I felt much more of an imperative to do it, and it's why I've continued. On the other hand, as a political ideology, as an idea that women have the right to do this, I hadn't necessarily considered what it would be physically like to terminate a pregnancy, to look at the products of conception and recognize the human face of that. I had thought of it always as, some blood and tissue. I hadn't really conceptualized. I thought a lot about the woman, but I hadn't thought a lot about the reality of doing the work. And it was shocking. It was really shocking for a long time. It was shocking that I was, yes, helping an individual woman in a situation and conditions that, required her to make this decision. And in order to do that, I was terminating a life, not, terminating a pregnancy is kind of easy language to talk about it, but it's a life, it's a potential human being. And so that was, it was shocking and it was difficult. Now, I can't say that it ever made me think, I don't want to do this. So I didn't think, oh my God, I didn't know it was this. I thought it was that, not this. I always knew it was this. But it required me to be thoughtful about it, to talk with folks about it, and to talk about the reality of, the fact that, all of my medical training had been toward making people better, saving lives, not ending lives. And so that it didn't ever shake my belief that I should be doing it, but I did have to, acknowledge and then work with the feelings that came up in the beginning.
I'm not so good at math. You might be better
We're
than
a pair.
I am.
We're a pair then.
How many abortions do you do a day now?
Yeah, probably on average, I do 18 to 20 abortions a day. Occasionally, I do significantly more than that, and sometimes less.
So how many a week do you think?
Well, probably between 80 and 100, depending on how many days I work in a week.
So And if we multiply that by...
20.
So...
2.
22.
Yeah.
That's intense.
It is. It
so
is.
That's a lot of saving and a lot of killing.
Yep. Yeah, it is. It's... And there's interesting things to be said about that. I mean, the reasons to do it are no less compelling now than they were when I started. They're easier in some ways that I've come to understand that women and what their process of decision making is, and to understand, that conditions are there that cause a woman to, and a family. It's not always, ideal with women as my patients, but they make their decisions in the context of a family or a relationship, or not. Many women make the decision by themselves. But I've come to understand that, what that process is like, and how, intimately I know the kinds of lives that many, many women lead. Hard lives.
A lot of people have an idea that, most of the people who are coming in getting abortions weren't practicing with any kind of contraception, or there's kind of, unforeseen circumstances that led them to this day that they're in your office. Is that true?
No. The majority of women that I see are doing something to prevent pregnancy. They may not be doing it well, they may not understand completely the method that they're trying to use. They may not have the intellectual resources, the financial resources, the sort of support to use a method effectively. So, for example, a woman may be taking the pill, but she may work shifts. She may live on the street. She may live in an abusive situation where she has to hide the taking of the pill. And so inadvertently she may miss taking a pill. She may take it at different times of the day because her life is chaotic and that's the best she can do. And so the method fails. But I would say that by far, and statistically we know that by far the majority of women are doing something to prevent pregnancy as best they can. Something that I often say to women is that birth control methods aren't perfect. There's a failure rate for every method. There's not a single method, except probably abstinence, that will be effective even if you use it perfectly 100% of the time. So I often say, birth control methods aren't perfect, and people aren't perfect. It's quite a task we ask women to do. If you think that often around age 13 or 14, women have the potential to become pregnant, and they can continue that until their age, 52, 53. So if we, try to do that math again, we're asking women for 35 years to do something on a daily basis. And I don't know about you, but I can have a week's worth of antibiotics and have a hard time remembering to take all the doses at the right time. And so it's an incredible task we're asking women to do, even under the best of circumstances. And so, birth control methods aren't perfect, people aren't perfect, and in this life that we lead, shit happens. And I often say that to women because they feel this incredible guilt and responsibility. One of the most common things that women say in our clinics is, everyone here is so nice. I didn't think it would be like that. Women come expecting to be judged. They come believing that they're in this situation because of some deficiency on their part, that and that people have a right to judge them and will judge them. And so they're surprised when people treat them well.
Yeah.
What a sad kind of reflection, what kind of a sad situation. But nevertheless, that is really common that women feel that way, for sure. Yeah.
You're a Buddhist practitioner. And you've really invested in this practice.
Mm-hmm.
And the core of this practice is nonviolence.
Mm-hmm.
That's the doorbell. The core of this practice is nonviolence.
Mm-hmm.
Not having the intention to cause harm.
Mm-hmm.
So,
Mm-hmm.
how do you put that together in your heart?
Yeah. You know, on paper, at face value, in some ways there's no reconciling it.
Mm-hmm.
I mean, I can't live up to all the precepts in the work that I do.
Mm-hmm.
If one considers doing no harm,
Mm-hmm.
non-killing in its literal sense, then, I'm not living up to the precepts.
Mm-hmm.
On the other hand, I think that, and people, Buddhists far wiser than I, are able to look at individual situations and understand that there are circumstances that allow one to hold all of these things at one time.
Mm-hmm.
And so for me, I feel like, in a way, the way women are doing the best they can, I'm doing the best I can.
Mm-hmm.
I'm holding a principle or a value that is really important to me,
Mm-hmm.
that I try to think about in my life in as many ways as I can. And I'm holding a commitment to supporting and honoring women and families
Mm-hmm.
in the best way that I can. So I don't have, I can't reconcile
Mm-hmm.
it, really.
Mm-hmm.
I can't, do sort of fancy footwork
Mm-hmm.
to kind of get around it or say,
Mm-hmm.
I just really, I've had to come to a place of feeling like I can hold more than one principle
Mm-hmm.
at one time,
Mm-hmm.
even when they're conflicting.
Mm-hmm. The other piece of this practice is mindfulness and generosity and that skill that we learn to really bear witness to our own suffering and other people's experience.
Mm-hmm.
Not just suffering, but joy and complexity and contradiction and the mess of what happens in our own minds when we're sitting still, but also how complicated it is to have someone in your office and all the conditions that brought them there. So I'm just wondering if you could say something about how the formal practice of meditation has influenced your work. And I mean the work of actually showing up and being there in the procedure.
Yeah.
You're a surgeon in a way, right?
Yeah, I am.
So how has the practice helped you?
Well, I guess, I would say that, interestingly enough, my practice actually really allowed me to focus on this ethical dilemma in a way differently than I had in the past. When I first started, as I mentioned, it was kind of shocking what I was doing. It was shocking to look at it. It was shocking to actually realize what I was doing. But I kind of got over that somehow. We'll just say I got over that. And it probably wasn't until I started and had developed a formal practice that I actually looked at that with more, with a clearer eye, with a allowing for the nuances, for the discomfort that came up as a result of that. So the practice actually helped me, or required me in some ways, to really look at and understand more fully what I was really doing at a whole different sort of level.
Yeah.
But then as a daily go to my office, meet a woman, I'm in the operating room, the practice has really influenced what I do. So I have a practice, a routine. If you can imagine, if I do 20 procedures in a day, I do them fairly quickly. I don't spend all that much time with any single woman. I read their chart. I chat with them about their decision about what's going to happen. And then the way the rooms are set up in various clinics, I have an opportunity. I actually usually turn my back as I put on gloves and prepare to start the procedure. And I always stop and take a few mindful breaths. And I do that with the intention of, for sure, arriving fully with that patient, so that I'm there, I'm paying attention, I'm not thinking about the fact that there are 10 other patients or what happened with the last patient, that I'm really quite there with them. And the other intention with that is to really open my heart to what will transpire between us, because even though the procedure is only a few minutes, 4 or 5 minutes to do, that 4 or 5 minutes for that woman may be emotionally quite difficult, may be physically, may be painful. She may have emotional reactions to that. And if I am there and I am mindful and I am open, it's so much easier for me to support her, to not be mad at her. So if she starts wiggling, which makes it harder for me, which makes me think, oh my God, something bad's going to happen, instead of saying, stop that right now, I'm really much more able to just be there with her. And the language that I use. So for instance, a woman may come in, she's very anxious. She is worried that it's going to really hurt. And one of the things I'll sometimes say is, it may be uncomfortable. What I'd like you to do is kind of open to the possibility that whatever it is, you'll be able to manage, and that we're here to support you with that. It will pass. So all of the, impermanence,
acceptance.
Exactly, and the sort of notion that you have within you what it will take to get yourself through this. And some of that I probably did before anyway, but now it's much clearer to me, and I can do it with intention. So if someone is going, way off into another place of fear related to some other experience in her past, I'm really able to kind of say, let's just stay here for the moment. Let's just take, and I'll say, let's take a couple of breaths together. I'm going to start, you let me know, what's happening. It will pass, we'll be done. And so in very practical ways, things that I've learned, to do in my own practice, the sort of, the teachings on impermanence have really had a very practical application for me. And if I get into a difficult situation, if I'm into a difficult case, either because of a challenging sort of surgical situation, I just absolutely use the breath. I absolutely just come into myself, and it is incredibly helpful. And I suspect that my complication rates have decreased as a result of this. Today I was teaching a resident, and he had a little complication, and I was saying, well, complications occur, and you have to be able to, try to sort out what's happened. And, an important thing is to be honest with yourself. And so I gave him the example of when I started practice and realized that what the difference was when I was fully there, fully paying attention in every moment, not starting out and, an abortion.
Not mechanical, it sounds
not mechanical.
like.
That's exactly right.
It's more immediate.
It is. It's a
So when you say complication, it doesn't mean accident. It means there is a complication.
Yes.
But how you respond to it changes whether that complication is going to get progressively worse, or it can be caught quickly.
That's right.
So the rate goes down because
pleasure there.
Yeah.
And it may not even occur.
Right.
Because,
you can catch something earlier on.
Exactly. I mean, I looked back and thought about complications I'd had and where things actually went wrong. Not just they might have gone wrong, but they did go wrong.
Yeah.
Something happened.
Yeah.
I made a hole in a person's uterus, for instance.
Right.
That's a complication that can occur. I suspect that those complications may have occurred in moments of lack of attention, that I'm doing something that I do 20 times a day, 5 days a week, 4 weeks a month.
Mm-hmm.
It's just routine,
Mm-hmm.
and I am not paying complete attention.
Yeah.
And I don't know this, for a fact,
Yeah.
because I can't go back to those times.
Mm-hmm.
But I suspect that some of those things may have happened in a moment of inattention. And I mean, I wouldn't want anyone to think I was a bad doctor and I'm sitting there daydreaming, because I don't think that's not what I'm. It's much more subtle than that. But I think that kind of capacity to really pay attention, to really be there, also really helps me. A challenging opening of the cervix dilation, and if I'm really there and I'm breathing and I'm focusing, I can feel my way through a difficult situation in a way different than if it's a mechanical thing.
Right.
This
is the protocol. This is what you do.
This is how you do it. Yeah, exactly. Yeah.
So the last thing I want to ask you is, primarily in the Zen tradition, but actually, if you go earlier to the time of the Buddha made his robes out of. There's a whole list of what you can make robes out of, but they were garments that nobody could use for anything else. Maybe they were menstruated on. Basically, what's been discarded becomes sacred or brought back. People, I would say, like Bernie Glassman, have done work taking discarded people, the people who we've thrown out of our society, and brought them back in, really by just giving them attention and bearing witness to them. And all these possible lives that have been put into the trash and, are back in the earth somewhere, or they're burned, or whether you have an idea that this is a soul, a potential life, all that aside, there is still something women have lost. And in some traditions in Zen, for example, they have a ceremony called water babies, or the Jizo practice, where you acknowledge the kind of passing of a child, the passing of a potential life. We don't really have any ritual like that in our culture.
No.
Is it important? Is it something you've thought about? Can you maybe comment on that?
Yeah, I think, it is important for some women. And I can't, it wouldn't be easy to say for this group of women or that group of women, but clearly for some women, some sort of acknowledgement of that past opportunity, that an honoring of, and many women have made the best decision that they can for their family, for themselves, but not without conflict, sadness, wishing that conditions were different than they are, and an honoring of that, and an acknowledgement that, just like for me, that this was no longer just a political idea. It was a clinical reality that I was ending a life, and my having to come to terms with that. Women have to come to terms with that. Now, you have a whole range of women who just don't think about that. They don't want to know about that. To women who have intention to have a ritual themselves, and so some women ask to take the products of conception away with them so that they
And can they?
In most places
Yeah.
they can. You know, they have to go through a process and sign release forms and, you know, all the kind of shenanigans you know about in, you know, hierarchical medical situations. But so some women, it's really important. And it turns out that it's important for me too. So I have myself a few Jizu statues, and I have them at my workplace, and I have, again, when you work in the same place over and over, you have the ritual places where you are. When the procedure is done, I take the products of conception into another room to examine them, and then to put them into the jar that they go away to the lab in. And in there, I have a statue. And I don't go through saying a prayer. I don't go, I don't have a particular thing that I say or do. But when I start in the morning, I do have an acknowledgement that I say. And when I finish at the end of the day, I have, and it's, you know, it's a very easy, not a highly religious or just an acknowledgement of what has happened in that day and to those lives that have not had an opportunity to. So I think it is, and it is important for some women. We don't have, you know, with miscarriage, for instance, for, you know, spontaneously losing a pregnancy, for years there was no acknowledgement for women that that might be an emotional, that they would have any attachment to that pregnancy. And those women, with the help of, you know, advocates of all sorts, have, I think, moved toward changing that, and now there is a much better acknowledgement that women may want an opportunity to hold a lost infant, or to participate or in some kind of ritual. And there are groups for women who have had spontaneous pregnancy loss. We don't really have that in abortion. We certainly have people who are very skilled at seeing women after abortion, to help them with ongoing issues, with, you know, questions and support. But we don't really have any kind of formalized rituals. And I don't know what the uptake would be, because people come with such different religious backgrounds that I'm not sure what the uptake would be. But but there might be interest in that, for sure.
This year we're going to have a ceremony at Center of Gravity called Oban. And what we do is we spend the day making lanterns, and then we paint on the lantern the names or even the faces or any images of people who we've lost. And then we go to a river, and then we light the candles, and then we watch the lanterns flow down the river in the evening. And maybe this year we should mention that if someone has had a miscarriage, or sometimes there's death that we don't really acknowledge, or an abortion, or maybe there would be a way that we could articulate that, where people might say, oh yeah, right, I don't think of that as death, you know, and have that as part of the ceremony.
I think it would be a great idea. I mean, at Center of Gravity, and in, you know, the mentorship program that I'm in, there have been practitioners who've talked to me about their own personal experiences of choosing to end a pregnancy, and what the impact was for them. And I think that there would be really, you know, most people have been affected by a pregnancy loss of some sort. You know, I think it's 40% of pregnancies are unintended. That's a lot of
40%.
So it's affected and touched lots of people. I think it would be a great idea. I would come.
Okay, you'll be invited.
Okay.
Well, thanks so much. the people who are watching via that camera and cord and computer will probably have a lot to say about this.
Yeah.
So,
Well, I'm certainly willing to, to chat with folks who have
Yeah.
specific, if they have questions or want to
Mhm.
enter into any kind of dialogue about
Okay.
it, I'd be happy to do that.
and if people want to communicate with you, they can email me.
Yeah, that would be great.
So thank you so much.
Thank you. Thank you for the opportunity.
Yeah. So part of the protocol in these videos is to finish with some homework. So this week when you meet with your partner, for 20 minutes, I want you to talk to your partner about the ways that you kill. So the question is, how do you kill? And to really take 20 minutes to speak with your partner about all the ways that you kill. Think about eating, sourcing your food, what you purchase, what you consume, your relationship with time, and really contemplate this kind of literal level of the precept of nonviolence, and contemplate how you kill. And then your partner can have a turn for 20 minutes, speaking to you about this as you listen. And then for 20 minutes, have a conversation about what that was like, to explore that question. How do you kill? So, thank you.